Welcome to Medicare School Daily. If you are turning 65 soon, or maybe you just turned 65, you may be wondering, what all do I have to do for Medicare? Because there's a few different ways you can kind of go about it. So in today's episode, we're going to walk through step by step, if you're turning 65, what you need to be considering and what you need to do to make sure that you are set up correctly, whether that means you get Medicare or it means you don't even get Medicare right now. So stay tuned. During this episode, we're going to talk all about that. If you want to be on today's show or any show in the future, we air Monday to Thursday, 11 a.m. to noon Central Time every day. We would love to talk to you. It's a great opportunity for you guys to get your questions answered from one of the nation's leading experts on Medicare in a non-sales environment. We're obviously not selling you anything on this live stream. So if you just have some questions, we would love to chat and get those answered. If you have an experience that you feel is helpful to other listeners or viewers to hear, we'd love to hear that as well. We get smarter. Our listeners get smarter by hearing what's really going out in the real world. So don't keep that information to yourself if you feel like you had an interesting or a unique experience. We'd love to chat with you. If you want to be on the show, the phone number's down at the bottom of the screen, 833-824-2004, 833-824-2004. Call in during that time, and we'd love to chat. If you guys need immediate help, this show is brought to you by MedicareSchool.com. We're a team of insurance brokers. So right outside these studio doors, we have people that come to work every day wanting to help people understand their options and enroll in Medicare plans. Whether that's an Advantage plan, a supplemental plan, a drug plan, dental benefits, whatever it is, enroll in Medicare, enroll in Social Security. We are here to help you do all of that, and our services are free to you. There's no cost to work with our company. We don't work for free. We're insurance brokers, so we're paid by the carriers if you choose to enroll in one of the plans. Two things I think that are unique about working with us. The first one is the people that you talk to, they aren't going to be paid any different depending on what plan you end up enrolling in. Most of your local brokers that are kind of working out of the trunk of their car, or a lot of these call centers, they're paid differently based upon how much revenue they bring into the company. We made a decision from day one to not do that. We want the advice that is given by the people on our team to be without financial benefit to them. So they really can truly, you look at your situation and help you find the best thing. And then secondly, you're assigned a dedicated client care manager for life, right? So you have somebody that you can always go and talk to. If you move, if you lose your ID cards, if you have a billing issue, a claim issue, if your Medicare supplement goes up in price and you need to shop plans, we are here for you. You don't just have an 800 number with reaches some call center on the other side of the world. You have somebody who knows you and is able and willing to help you. So if you want to work with our company, the phone number is 800-782-6676, 800-782-6676. We have people that are available throughout the day if they're available, but you can also schedule an appointment for when it makes sense for you. Okay, let's hop into the education. So if you are turning 65 soon, what's the step-by-step kind of process you need to go through?
All right, so there's two main things I want to talk about in this subject. Number one, the decision that has to be made, and then really the process that we go through. And so the decision at 65, there's one that's obvious, and that is if you or your spouse are no longer working, you're going on Medicare. Yeah, okay, you're going to make a mistake if not. So that's the obvious. But what's not so obvious is there's four other groups of people that need to start Medicare at 65, and if they don't, they're making a mistake. And that's anyone that's going to be covered by COBRA insurance, anyone that is covered by TRICARE, meaning retired military, anyone that is working for a small employer plan, 19 or fewer on the payroll, you must start Medicare 65. And lastly, anyone that's presently covered by an Affordable Care Act plan. They too have to come off those because they're going to lose their financial incentives. So again, that's the decision. So if we're no longer working, covered by TRICARE, COBRA, small employer, or ACA plans, we're going on Medicare at 65. Now, if someone is not on Social Security, they're going to have to self-enroll. If they're already on Social Security, they're going to be automatically enrolled. So just a quick example as we talk about the process. So enrolling into Medicare, if you're on Social Security and your birthday is coming up and you're going to turn 65 in August, then the Medicare card is going to show up this month, basically around April the 20th. So very, very soon, Medicare card shows up. But if I'm not on Social Security, I'm not automatically enrolled, so then I have to initiate the enrollment, and we have a 7-month window to do that. It is 3 months before we turn 65, the month we turn 65 and then 3 months after. So if I have to start at 65, I have this 7-month window to enroll. And what matters is the month I enroll determines when they're going to start my coverage. And so let's go back to the birthday of August of coming up. I'm not on Social Security. So we back up the clock, July, June, May. So May 1 through my first 3 months would be May to July. My coverage starts August. But if I enroll my birth month, they put me off for a month. So if I enroll in August, they're going to start me in September. Enroll in September, they start me in October. October, they start me in November. Then my last 7 month, it would be November. They'll start me in December. All right. So the whole point is that's the process, and that's called the initial enrollment period. Very easy to do. People work with us. We'll do it for them anyways.
How do you do it?
We go to SSA.gov. We have to have an SSA.gov account, and then we do an A and B enrollment online. Okay. So real simple, and we're happy to guide people through that process.
Yeah, we do it all the time.
All right, so that's the group that has to go on Medicare. Now, I want to another group of people that may at least consider Medicare, and that would be anyone that is approaching 65, but they're still working and they're covered by a large employer plan, 20 or more people on the payroll. What they should, even if they don't want to go on Medicare, they at least ought to take the time to compare.
Yeah.
What's my Medicare option versus my employer option? And sometimes the employer plan is excellent. We had a lady we just talked to, right? $60 a month. That's awesome. But there's some people today that are paying $300, $400 a month for their plan, and that's not so good.
$5,000 deductible,
exactly
$10,000 max out of pocket,
right. So,
$350 premium. Like Medicare's way better.
Exactly.
Yeah.
So if Medicare makes sense, then your employer has to let you go on Medicare your birth month.
Yeah,
and so 65. Take the time to compare. And of course, we're happy to help people to analyze that to see if Medicare makes sense. And we'll be honest. If Medicare is better, we'll tell you. If it's not, we'll also tell you that as well. And so this group of people that is turning 65, at least make the comparison. Look at the premium, what's the deductible, what's the max out of pocket, how your medications coverage. And so we go through these steps to see if Medicare would make sense. Now, sometimes we'll have people that have a mediocre plan, maybe even a plan that's expensive, but their spouse is covered by it, or their kids are covered by it up until age 26. And then sometimes they just simply have to stay on those employer plans because it's going to adversely affect their family. Sure. But if it's not, then we can of course move to Medicare. All right, so that's the steps. Now, I want to clarify something for those who decide they're not going to start Medicare at 65. It is fine to do A only. As long as you don't have a health savings account. Because if I enroll into A only,
you're going to continue working.
That's right. You're going to keep working. That's what I'm talking about. So people that are going to keep working, they're not required to do anything with Medicare, A or B. But if they have an HSA, definitely don't do A or B. But if they don't have a health savings account, enroll into A only.
Yeah.
I think it's smart to do that.
Not to.
That would be our advice. So that's the steps. And then just make sure if you don't start Medicare at 65, it is fine. And you're going to work till 67, 69, as long as you're covered by an employer-provided plan, you or your spouses, there'll be no penalties and no problems whatsoever. We call that the special enrollment period.
So let's say let's future pace a little bit. So somebody took your advice. Maybe they got into A, but they're going to continue working for 3 years.
Right.
Now they're 68. How do they get into Medicare now?
All right. So first off, we're assuming now they've set a retirement date.
Yeah.
So what I would do, I'd back up the clock 60 to 90 days. You cannot do it any sooner than that. So in 60 to 90-day window, now we're going to apply for Medicare Part B. And so that's called—
You already have A.
Yeah, we already have A, so the forms are simple. There's two. One's called an L564. That's filled out by your employer. You initiate it, of course, but your employer completes it, verifying that there has been active work, active insurance at work. So that's the L564. It proves credible coverage. And then we have a form called the CMS 40B, and that's the form we use just simply to select our B date.
Yeah.
So if my coverage ends July 31, I put on my CMS 40B, please begin my Medicare B August 1. Yeah. And again, the 60 to 90-day window is perfect. If people want to do it before that, they're not going to process it. Okay.
What if somebody gets laid off unexpectedly?
Okay, and no panic. Let's say it this today, if someone got laid off today, mid-April, we can start their Medicare, no problem, May 1.
Okay.
Okay. Now we may not have a Medicare card, we may not have insurance cards, but we have coverage. They have a heart attack May 1st, they will absolutely be covered. Yeah. So I've literally done it the last day of the month before in telling people with confidence, if you have a heart attack tomorrow, you're covered.
Yeah. How long do they have?
For what?
From the time, let's say they're laid off, to get everything set up without any penalties or anything.
Oh, well, they have up to 8 months, but we're never going to use 8 months.
Yeah.
Okay, but that's why we don't have to panic.
I think one warning, though, because we hear this a lot, people, part of being laid off is their severance includes some COBRA.
Right. If that's the case, let's say COBRA's paid for, then what I would do, we still have to go on Medicare immediately because COBRA moves to the second payer position. So we're going to go ahead and have A and B first, COBRA second, but we're not going to lose our Medigap OEP, which is that opportunity to get a Medigap policy 6 months of the B date without any underwriting. So I'm fine using COBRA, especially if it's no cost.
But let's
be on 6
clarify
months.
that.
Okay.
Using COBRA with Medicare.
Exactly right. Well, yeah, COBRA's only second. So you have
Once
to
you're eligible for Medicare, COBRA will always only be second.
That's
so
right.
that puts you in the first payer position if you don't have Medicare.
That's right. So yeah, COBRA only pays second. So you enroll in
a
A
lot
and B.
of HR people don't know that.
Yeah, they don't. Exactly right. But and I'm all right using COBRA in the second payer position, just not beyond the 6 month window for a Medigap policy, because for some people, especially if they have health problems, they'll never get a MedSup plan unless they live in New York, Connecticut, or Massachusetts the rest of their life. So we don't ever want to lose that opportunity.
Okay. So all this entire conversation was obviously around enrolling into Medicare A and B, timelines, process, all of that sort of stuff. Beyond that, Medicare, started in 1965. It's improved a little bit, but not much, since then, really. And healthcare, inflation, and all this stuff has changed rapidly. So most people end up getting either a Medicare supplement, like a Plan G or a Plan N, or an Advantage plan. So how can they go about doing that?
Okay. Well, if they're...
Well, first they need to learn about the differences.
Exactly right. That would be it. So, half of all people have Advantage plans today. About 45% have secondary insurance, such as supplemental plans. 5% have A and B only. Yeah. So the best way to learn about it, in my opinion, would go to our website and really begin to get a basic understanding of the difference of these systems. They're both insurance, but they just work differently.
Yeah, and there's neither of them. We may, I think here on this channel, we probably have a slight leaning towards Medicare supplement plans for sure. But I think it's because we understand them and we've done this for 15 years and we see what happens when, we don't have people complain other than the price went up on my supplement plan. But they don't complain about the coverage. We hear complaints about Advantage plans frequently. Don't want to beat up on them, but a lot of times you call into a broker or a lot of these companies, they're just going to push an Advantage plan because they make more money and that's all they've been trained on. So you really need to do yourself the favor. And we help people into Advantage plans every single day here, but you need to do yourself the favor to understand those differences. So, kind of like what you said, if you go to our website, it's called MedicareSchool.com. We have what's called a Medicare Essentials Workshop. It's about an hour long. It's my dad, Marvin, teaching kind of A to Z Medicare. He talks about enrollment, but he spends a lot of time talking about what are the differences between Advantage plans and supplemental plans and how you can make a choice there. And then, guys, just to kind of close this out, after the fact, once you kind of have an understanding, we'd love to help you. We're a team of insurance brokers, right? And we would just, consider it an honor and a privilege to work with you and help you select what is the right Advantage plan, what is the right Medicare supplement, what carrier, what makes most sense, how do I get my drug coverage? We can help you do all of that.
Yeah, and I want to just add to that too. Whether someone uses us or anyone, there's never a cost that you pay to the agent. No different than homeowners policies and auto policies. Your agent doesn't work for free, but the insurance companies pay us, not you. And so we really can approach this very unbiasedly. We can't. We're going to give you advice based upon your situation. So we'd be delighted to help. But whoever you use, there's no cost whatsoever.
Okay, let's talk to Barb in California. Hello, Barb. Welcome to Medicare School Daily. How are you?
Good. Good morning, Marvin.
Good morning. Yeah. What questions do you have for us today?
I have recently been terminated from the job that provided my medical insurance, and I've enrolled in A and B. I've sent my request to my former employer to confirm the information, but I've gotten no reply. And my question is, what's my next recourse step of action if they don't reply?
And so when you say that you have enrolled into A and B, I'm assuming you did that online?
Yes.
Okay, and when you did so, did you upload any information, or you just supplied them with the information that was asked you online?
I don't recall uploading anything.
Okay,
but I got the key number and.
Okay,
Sure.
that sounds good. I understand. Now, let me ask you this.
Okay.
In the comments section, did you tell them when you wanted to start your Medicare Part B?
Yes.
Okay.
And that will be August.
Oh, that you requested an August date?
Yes.
Why?
Okay.
Why did you request August? That's kind of a ways out still.
Well, because I'm under no medical care for anything whatsoever.
Okay. So
Do you have insurance right now?
And being no, it ended April 1st.
okay, yeah. So I understand. So you requested an August 1 start date on the B.
Yes.
Okay, that sounds good. Well, I would tell you, and again, I hope all goes well between now and August. But you did put yourself at a little bit of risk, and can I assume this, that your employer is not going to provide COBRA insurance? Would that be correct?
It was offered, but I wouldn't
Okay.
accept it.
Okay,
It's so rare to use any of the insurance.
Okay, and that's certainly fine. Okay, so let's talk about your form. So the one that you submitted to the employer, how long ago did you submit that to them, requesting them fill it out and get it back to you? Has it been a couple weeks, or how long?
It was 2 weeks.
Okay, about 2 weeks. Okay, and do you have anyone in the HR department that you can make personal contact with to see the status of that?
I would. Well, there are a number of. I've lost all the email contacts since termination because of not having access there. So the next step would be a call to follow up on my email.
Okay, that sounds good.
Since I got no confirmation.
And when you ask them to fill that out, I'm assuming that we're talking about the form that's called the L564. Is that the form you sent to them?
Yes.
Okay.
Request for employment
Yeah.
verification.
Yeah, good. Okay, sorry about that. Yeah, that's was okay. So you did the right thing, and so I have seen some employers not turn these around real quickly. But again, you have not requested a B date until August 1 anyway. So I think you're fine. If you want to give it another week or two, if it were me, I would try to reach out to someone just to see where that is. Did you then ask them to email that back to you once they completed it?
Yes.
Okay, very good. All right, so let's say, good side, they get it back to you soon. Now, what you're going to submit then is another form. Even though you requested the August 1 start date, I would not take a chance. I would also include a form called the CMS 40B. CMS 40B, and maybe you already have that, but that's the form that I definitely would fill out. Your employer has nothing to do with that form whatsoever, and so on the 40B form, it's easy to complete, and then you're going to put on there again, please start my Medicare August 1, if that's what you're comfortable with. Okay. Now, let's say they don't get it back to you. Here's what you also can do. You can fill out your own L564 form. You have all the information, when the insurance started, how long you worked there, and all that. And then what I would do is you just go ahead and sign that yourself. We have had people that have had to do that before. And then, you could always... you can do that. I know it sounds odd, but it will go through for sure. And so, again, I would tell anyone else, I would still always ask the employer to do, but if they don't get back with you, then you can do that on your own. So I'd give it a week or two at most, and then if you want to go ahead and submit the forms, then you can actually upload those on the SSA, your SSA.gov account. If you don't want to upload those, then you can still drop those off at a local office, if you would like. It's fine to do that. Do you have an office, Social Security office that's fairly close to you?
Probably. I've not looked into it
Okay, well, and if not, if you don't, those always can be mailed in. Our only problem and advice to you is this. If someone's going to mail those in, then we would suggest mail and fax. If you just do one of those, something could go wrong. So if someone faxes in, we also say mail it in, and you can do that in a local office. And by the way, if there is a local office close by, you don't have to have an appointment. You can just simply go down there, have the paperwork in an envelope, and then just turn that into, usually there's a guard at the door, and I'd put on their Medicare special enrollment paperwork. Okay, so that's my advice to you. And then, of course, here soon you're also going to be able to look into the decision whether you're going to go with an Advantage plan or with a supplemental plan, drug plan, and all that.
Do you kind of have clarity on what you're going to do beyond Medicare A and B?
Yes, I've listened through the training video that you provided. And I would eliminate Advantage plans and focus on selecting a Medigap.
Okay.
Sure.
Now, I'm going to give you a word of advice. Here's what happens. Your employer coverage ended April 1st. So what you're going to need to do, even though you decided to put B off until August 1, you need to set up a drug plan within 63 days of losing the employer coverage. You do not have to have Part B to have a drug plan. You can have a drug plan with Part A alone. And so now, were you already enrolled in A only? Or did
already no.
Okay.
That was done just March 31st.
Okay, well, let me tell you something. Here's another thing, Barb. Here's where you stand. Do you need to go online? And you said you did enroll for sure. I mean, you got a confirmation of that, I'm assuming. Is that correct?
Yes.
Okay, good. Okay, so here's what they're going to do. They're going to backdate your A date 6 months, which is no big deal. But once I would give it probably about another month or so. Then I want you to enroll into a drug plan, and I'd want that drug plan to start June 1. Because you have to be on a drug plan within 63 days, or you're not going to be able to add one. And it's no problem to do. It's very easy to do. You would go to Medicare.gov. Of course, if you're going to work with us, we'll do all this for you. So that's probably the easiest thing to do. But let's do a Part D plan to begin.
So she needs, if you're going to work with us, just call in and do everything. We can delay your Medicare supplement to start in August.
That's right.
To coordinate with when your Part B will begin, but you need to get your drug plan set up now.
Yeah, by June 1. Yeah, and you'll be
Otherwise,
just
you'll
fine.
have a lifetime penalty, and what's the point of that?
Yeah, there's no reason for that. They only give you 63 days once we've lost employer coverage to get on a drug plan. And you can split it up. It's no problem whatsoever. And just be sure the agent that you end up talking to said, hey, Marvin said we got to get this done by June 1 because of that 63-day limit. Okay? Mm-hmm. All right. Any other questions that you have for?
Drug plan. Yes, the one that just came up was with the focus on getting the drug plan going. Are there any circumstances that the drug plan really is not needed?
Yeah, not real. What's your zip code real quick? Because a lot of times there's very, very inexpensive drug plans, and I just want to check that.
Yes.
Because here's the problem. If you go without drug coverage, yes, there's a penalty. But, I mean, you've been maybe watching our show. We talk to people who, they get put on they're healthy right now. And then 6 months from now, they're getting put on a medication that's, $10,000, $11,000, $12,000. I talked to somebody yesterday on this show, $33,000 a month, for some, I don't know, autoimmune disorder or something that came up. And so if you have a Medicare drug plan and it's, that drug's on the formulary, it's going to be capped at $2,100 out of your pocket for the year. If not, you're paying the cost of that.
And here's another issue. If we don't take a drug plan now, Barb, you can add one later this year, October 15th through December 7th, but that plan will not go into effect until January 1. Yeah. So I just wouldn't want you to be all this length of time without a drug plan at all. So I just don't think that would be a good idea. And Josh, you had some numbers for her?
Yeah, so there's a $0 drug plan in your zip code.
Yeah, zero premium.
So it's not going to cost you anything.
Yeah.
Right, so you might as well pick it up. There's one for $5.70.
Yeah,
so we're just talking about very inexpensive amounts here.
Yeah, you need to do that, Barb, for sure. Okay?
Understood.
Okay. Anything else beyond that?
No, that's it for today. Thank
Okay,
you.
sounds good. Well, thanks for calling in, and appreciate the opportunity to be able to serve as your broker, too. We want to help you.
Thank you, Barb. Bye-bye. I don't understand why she was trying to delay for 90 days.
Well, she's healthy. She's taking the risk.
Okay.
Yeah,
What if
yeah.
you get into a car accident and you're in the hospital
Yeah.
for 90 days?
And you know what she did? She thought she went that 3 months out.
Yeah.
Yeah. So, and I didn't want to get into that.
Oh, yeah. Will they accept it? Part B application
Yeah.
that goes in April?
Well, it wants the L564 because she has 8 months of an
8 months
SAP.
from when the ended.
Exactly
Okay.
right. Yeah,
There
she's
we go.
fine. It's just too
kinda
risky.
weird. Yeah.
I
wouldn't do that at all.
wouldn't either. Yeah. But
You're
again,
going to save a few $100s, $1,000 over the course of maybe 4 or 5 months of coverage, really? I don't know. It just seems like...
yeah. Well, what that really is, it's what is the statement? Penny wise, pound foolish. Yeah, I mean that's really what's going on in that kind of situation. So, but hey,
Yeah, if she wants that risk, she can take that risk.
no problem whatsoever.
So a few moving parts. I did not even think about how she needs to have a drug coverage in effect within 63 days. So that's
Right.
glad you flagged that.
Right. Yeah, and I think what's important for all people to realize is that even if we take no drugs, we want a drug plan.
You don't take any.
Yeah, exactly. I don't, but things can change very quickly.
Yeah.
There'll be thousands of people this month diagnosed with cancer, so they're going to need meds, and so everyone needs a drug plan.
Okay, let's talk to Jim from Colorado. Hello, Jim. Are you there?
I am.
Hi there. Welcome to Medicare School Daily. What's your question, sir?
Hi. My question is about the month in which I should start receiving Medicare benefits, whether that's December of this year or wait until January of 2027, 1 month wait. I turn 65 in December, but not on the first of the month.
Okay.
I'm currently insured on a retiree plan, which is expensive.
Okay.
I'll likely purchase a Medicare supplement plan rather than a Medicare Advantage plan when the time is right.
Okay.
If I have a December start date of this year, I'll need to consider filing an IRMA appeal for that 1 month because I was still working in 2024 and our income exceeded the $218,000 limit for married filing jointly. And I'd also need to re-enroll right away for 2027.
Okay.
On the other hand, I wonder if another consideration is around how Medicare premiums change each January. Does Medicare automatically look to your 2025 income for January 2027 premiums?
Yes.
Or is there a delay of some?
No, there's not a delay at all. As long as you filed your taxes that they have access to 2025 taxes,
It'll be
they'll
based
have
on
it.
that,
Exactly right.
Okay. So there's no delay such that they'd still be relying on my 2024 income if I enroll for January.
Yeah.
So that's what I'm curious about. The delta would only be the difference between my retiree plan premium and my new premium if I waited until January. That might be a few.
Well,
What's
that's
your
not
retiree premium, just so we have that info.
But let me. Okay, that's fine. But here's the issue, though. Your retiree plan is going to go to the second payer position 12-1. So you cannot do that. You will be in the first payer position if you do not take B until January 1st. So it's way too risky. I know you have an IRMA, but hey, you can appeal the IRMA. That's what I would do.
form.
Exactly right. Because see, once someone is eligible for Medicare and they're on anything other than an active employer provided plan, that secondary plan is going to go to the second payer position. So that's your risk involved, Jim. So I would not do that if I were you, sir.
You wouldn't. You're saying that I wouldn't. I shouldn't wait until
don't delay.
January. I should just do it in December.
Yes, sir.
Of December.
Yes, sir. You want to start your B12-1. Now, listen. You don't have to have a supplemental plan in place. 12-1. You can put that off until January 1 if you want to. It's fine if you want to use your retiree in the second payer position. But I promise you, A and B, you have to. I'm assuming you're not on Social Security, so you're going to have to initiate 15th in enrollment, and we want to start A and B.
That's right, I'm not.
Yeah. You want to start A and B 12/1 of 2026.
If not,
I was.
go ahead,
finish your follow-up.
If not, you'll essentially be counted as primary.
That's right.
And then your retiree plan will count itself as secondary, even if you don't have Medicare. So Medicare should be primary, and if you don't, then you're primary, personally.
I was considering just dropping off of my retiree plan. If I start, on either date, I would drop off my retiree plan on that appropriate date.
Yes, sir.
Yeah.
And that makes sense. That's what I would do, especially if it's expensive. Be done with that. 11/30 and 12/1, everything's going to be Medicare, and then your supplemental plan.
Yeah, and then
your point is a good one.
Just to speak, you said then you're going to have to renew your coverage for the first of the year. Just so you know, the Medicare supplement plan, a lot of people think that it works in a calendar year basis. It doesn't work like that at all. When you sign up for a Medicare supplement like a Plan G or a Plan N, that plan is yours for life. It's not going to change its benefits. It's not going to send you a new card every year. It's not going to do anything like that. The only thing that's going to happen is there will be a premium increase every year. You should expect that.
Right.
That, for most carriers, does not even happen on January 1st. It actually happens usually between April, May, or June. So you get your supplement plan set up in place, nothing's going to change on that, or you're not going to have to renew it or call and say you want it again next year. Nothing like that. Okay. Now, the drug plan is a little bit different. If you work with us, what our agents will do is they will say, okay, what's the right drug? Do you take any medications?
I do.
Okay.
Relatively easy
inexpensive.
Medications, nothing complex. Yes.
Well, likely the plan that you're on for December will be the plan that works for you for 2027 as well. There may be a very slim chance that there's if you were on an expensive medication, this is a higher likelihood that you would be on a different plan for the month of December, and then you would be on a new plan, January 1st. That's probably not going to happen.
That's rare.
You're probably going to end up on just whatever plan you enroll in December will automatically, renew for January 1st. So, but our agents, as long as and here's the time I would recommend for you to do this. Schedule an appointment with our company for the first 2 weeks of October, okay? Sometime in there, because the 2027 drug plans will be out. You'll be able to get your supplement in place. I wouldn't wait till after October 15th. Do it the first 2 weeks of October. The supplement plans will be out. The new drug plans will be out. So the agent that you talk to will be able to say, hey, this is the 2027 plan for drugs going to be the same as, December of 26. That's going to be your best. If you wait until after October 15th, the annual enrollment period has started and it's just crazy. If you do it before October 1st, you're going to have a follow-up appointment to make sure that December drug plan is still good for 2027.
That's right. Yeah, because we won't know those 2027 drug plans until after October 1. So Josh is exactly right. That's the way you do that. And I would say this, if it were me, I'd probably do it the second week in October.
Yeah. Just like October 5th, 6th, 7th, somewhere in there. Yeah, not the first, because
sometimes the plans are a little bit slow.
Yeah, the plans come out and then they adjust their benefits 2 days in because they filed something wrong with Medicare or whatever. So,
truly, the 5th to the 7th thereafter is just really perfect.
Okay. So to recap, all things considered, recommendation is I enroll to start receiving benefits as of December of this year.
Sure.
Get A and B buttoned up, a supplemental plan buttoned up at the same time, and then let things occur. And then I also, I get out of my retiree plan as of December 1st as well. So I've only got 11/30. That's right. I let things lapse on that side. I move forward with a supplement plan as of the month of December, and then let things happen in their regular course for the renewal in January. The change in premiums.
You'll appeal the IRMA for December, but you will not have one. Okay. If your 2025 income is below the threshold, you're not going to receive a notice saying you owe one in 2027.
Yep.
That's right. Yeah, our joint income is
below 218.
That threshold for our 2025 income.
Yeah. So you just have one month IRMA. You can appeal it. You'll win it. And by the way, who knows when you even get that IRMA notice? It may be, January, February, but don't worry about it. When it comes.
When should he apply online for Medicare?
Anytime after September 1st.
Okay, yeah. So if you do it right around the 1st of September, I think that's the first thing you have to do.
That's right.
You'll have your Medicare number by the time you talk to our team, which will make all the enrollments easy.
Yeah, be very simple. Yeah.
Oh, great. Yeah. That's good to know. I was thinking that it'd be at the same time in October.
No,
so I should
do your Medicare enrollment online. It's really easy to do.
Mm-hmm.
And then you'll have a Medicare number by the time it's time to get all your plans set up.
Right. Yeah. And then I just want
to supplement set up in October.
Yes, sir.
Yes.
And the drug plan. Yes, sir.
Yeah.
Okay.
And then you have to have a Medicare number to do that. And so we're saying,
oh, great. Okay.
Yeah. So we're saying enroll September 1st or 2nd. And then it takes about 3-4 weeks. You'll have your card, you'll have your number, and then you'll be good. You'll be sailing. This will be easy for you.
Yeah, and I was going to add this as well. Your bill, you're going to be on a direct bill with your Part B premiums. That first bill could be 2 months, 3 months, 4 months, or 5 months. Whatever it is, just pay it. Okay, your IRMA. I'm telling you, your IRMA bill for that 1 month is not going to. It's not going to probably show up for a couple months. When it does, and once you get your letter, though, your IRMA letter, which again is probably going to be sometime in November, then you can appeal it. Okay, the letter has to come first. Okay, and then after you've done you've paid that first Part B premium, whatever the amount is, then you can set up some kind of an auto pay with the government. There's several systems to do that. Okay, so that's what I would do. And then
great. Well, thanks so much.
You're welcome. Hey, great to talk to you, Jim.
I really appreciate the content that you publish. It's all very helpful.
All right, our privilege.
Thank you.
Good to talk to you, sir.
Take care. Okay, next caller, Kent from California. Hello, Kent. Can you hear us?
Yeah.
Hey, how are you doing? Welcome to the show.
I'm doing well, thanks.
Good. What's your questions today, sir?
Well, I actually have a story. I started on Medicare back in August of last year, and I signed up through you guys. You're very helpful.
Thank you.
And I ended up getting on a WellCare value script.
Okay.
And it was last year it was $18 a month, and this year it went down to $6 a month.
Okay, nice.
which was that was a surprise to me.
Things do go down every once in a while. Don't get used to it though.
Right. So after I was on it for a few months, ended up being diagnosed, which I kind of knew I had anyway. It was type 2 diabetes.
Okay.
And went in, had a gallbladder problem, and they put me on metformin. So I started taking metformin, and then I had my gallbladder removed in January, and everything covered really well. And then on the drug plan, surprisingly enough, my doctor wanted to put me on Mounjaro. So after paying my $615 deductible, then it was only $11 a month for the rest of the year. So basically, it averaged out to about $61 a month, which is unheard of for Mounjaro.
You're right.
That's awesome.
And I was thinking I was going to have to wait for the program that they were going to do $50, but I'm okay with $61. And I swear to God, in the first week, my very first shot, it took care of my blood sugar.
We've heard that so many times. Congratulations.
Within a month, I was able to stop taking the metformin altogether.
That's amazing.
That's good to hear. How are you feeling? Feel good?
Doing really well and lost 25 pounds since February.
Wow.
It's amazing what those GLP-1s can do.
Yeah, there's been a lot of things I've been reading about other benefits to the GLP-1s, which
I feel like everything's not known, but there seems to be so many
positives,
positive sides. Mm-hmm. So that's really, really interesting. Thanks for sharing the story. What did you on your gallbladder? Was that inpatient or outpatient?
It was outpatient. I originally went into the emergency room because I had some pains in my stomach. They diagnosed it. They were thinking of taking it out while I was in the hospital, and then they decided it wasn't inflamed enough, but I had a lot of stones. And so then I went and did an evaluation with the doctors and what have you. And then my doctor said he wants to put me on Mounjaro, but he won't do it unless my gallbladder's removed, because one of the side effects is it can create more stones, and they didn't want me to get any more stones already having some. So I had it removed so I could start the Mounjaro, and I felt fine after having that removed. I don't notice any difference whatsoever. I guess I'm one of the lucky ones there, because I know you can have some complications, but.
Yeah. Did you say we set you up, or someone at our company set you up on a Medicare supplement?
Yeah. Yes.
Okay.
Yeah. I got
Did
a
you go with
Medicare supplement.
like a G plan or N, or what'd you end up with?
I went with a G plan, and I did the AARP United Healthcare, and so I got a discount for the first year. I'm a little concerned with coming up because I just got a notice in the mail that my rate is going up to $244 a month, where I'm paying $175 for the first year. I knew it was going to go up regardless because I was only getting that discount for the first year. But when I went into the Medicare webpage and I put in the information, it was saying it was only going to be $209. So I don't know why they're saying it's going to be $244.
Yeah. Well, the Medicare sites, when it comes to supplemental plans, are very inaccurate. They're just not up to date. And it's not like they want it to be that way, but we've just found the drug plans to be excellent through Medicare.gov, but most everything else not so up to date. So, and anyway, so I mean, what happened is across the board, we've seen those kind of increases. And you did lose your only 3% of your enrollment discount, and that was just a group increase that occurred. So, Josh, you want to say something about that? Let me shop it.
What's your when did you start?
He said.
So you started in
August of last year,
2025.
Okay, sounds good. Yeah,
right.
So here's what I would. And now California is an open enrollment state.
No, it's a birthday rule.
Birthday rule. So okay, so we can switch that. Yeah. So here's the deal. So all Medicare supplements, so United Healthcare has for 20 years, they touted that they had a less than 3% average price increase, which was true, right? I went up 2.9%. So it was been like, one of the best, number one carriers in terms of they have the biggest market share, all of these things. All of the Medicare supplement carriers, this is the third year now. And they're saying this is going to be the last one. We hope it is. Have been having to normalize to what has happened with medical inflation since COVID. It's just gone up so tremendously. So we had carriers that, for years we could say they're stable, 3, 4, 5% increase, which is normal. And now they're taking double-digit rate increases. So my point in saying that is you're not alone. I don't want you to feel like this is going to happen every year for the rest of time. It's not, unless country blows up or something there, but they kind of warned us all like, hey, this is going to happen for 2 or 3 years while we normalize, because for years, for like 10 years, it would cost almost the same amount to get a Medicare supplement plan. There was just hardly any inflation in there. And then the last 2 or 3 years post-COVID, utilization has gone up tremendously. You've probably seen all this in the news and everything. And so those med subs are trying to equalize to where the market needs to be. So, I was kind
of surprised because that's the only plan. That's the only plan that has where it doesn't matter your age. It's all community.
Yeah.
How do you say that?
Yeah, community rating. You're right.
Right.
Which is kind of.
It is community rated, but when you have that enrollment discount, it kind of it's a way around it.
Yeah, the community thing is kind of like a marketing thing, in my opinion. But
it's gonna go up like up $44 or $75 from what I'm paying now.
Yeah. Now the other thing to know is you do have. Are you going to the gym? At all?
Not yet.
Okay, well, under that ART plan, they do have a system called Renew Active, and it's very similar. Maybe you've heard of Silver Sneakers, but they have their own fitness network that's very extensive. And I believe the only Medicare supplement plan that offers this included is, free access to gyms. So, if you think a gym's going to cost you $30, $40 a month, kind of take that into account as well. So you're
that's good to know.
especially if you're you're on your weight loss journey, I feel like, and the GLP-1s, you're getting all healthy, might as well utilize that benefit.
Silver Sneakers and Renew Active, and Renew Active is UHC's 92648.
Yeah.
It's their particular network.
So you've
got free or low cost gym?
No, it's free.
Yeah. If the gym is in network, there's no cost to you for the membership.
You got LA.
That's great to know.
LA Fitness, Planet Fitness, Huntington Beach YMCA, Crunch Fitness, 24-hour UFC gym, LA Fitness. There's a lot.
The first two you said are very close to me.
Yeah.
And I wanted to start because when you're on the GLP-1s, they want you to do resistance training to keep your muscle because some of the weight loss, up to 40%, can come from muscle, which is not good.
Not good at all. So, join. I think that makes you feel a little bit better about sticking with that supplement plan, in my opinion. And I think he can join both of them, can't he?
I think there's multiple.
I think you could even join both of those. I don't think it's just limited to one. I know
check into that. But I think you are right. Just show them your United Healthcare Med Sup plan, and they'll do the paperwork for you, and there'll be no cost at the gym.
Yeah.
Oh, I just go to the gym and do that.
Oh, yeah, exactly right.
Oh, wow. Interesting.
Yes, sir.
A second question I had was, if I did want to change that plan, when you have the medical underwriting, is that if you change insurance companies, or how does that work?
Yeah, when in California, California's a birthday rule state. I'm pretty sure it's from birthday for the next 60 days. So, what birth month is your birthday in August? Okay, very good. So what that means is from August for the next, I think it's 60 days, you would not have to go through underwriting. So you just call our company in July. And then we can shop it to see if there's a better option for you. And what Josh was saying, that, hey, we may be able to save you, let's say $30 a month by moving to a different carrier, but that carrier is probably not going to have that free gym membership in there. So we would bring that into the equation. But California says, I think it's 60 days of your birthday, then there's no underwriting required. And what you would do, you can move from G to G or G to an N. Okay?
And as long as you stay in the supplemental plan, you're never going through underwriting as long as you do it on your birthday.
Yes, sir. You're exactly right. So you can call us a month before your birthday, and we walk you through that process, shop it for you.
All right. Well, I'm going to check into the gym stuff. That's great information. I didn't know that.
Good. Yeah. That's one of the unique things about United Healthcare.
Thank you very much.
You're welcome. We appreciate you calling today, Kent.
Take care. Okay, let's talk to Jeannie in Oklahoma. Hi, Jeannie. Hello. Hi, Jeannie. Can you hear us?
Yes.
Hi. Welcome to Medicare School Daily. What are you calling about today? What can we help you with?
Well, I turned 65 in February, and I don't know what I need to do as far as Medicare goes if I'm going to continue to work till 2029.
Okay. Did you say you will turn or you did turn?
I am turning 65 February 2027.
Okay, that sounds good. Okay. All right, so you're going to keep working. Let me ask you this. Do you have, Medicare has employer criteria. So are you working for a company that has 20 or more employees on the payroll?
Yes.
Okay, very good. All right, so let me ask you this. Are you contributing to a health savings account? That's called an HSA.
I don't think so. Is that where you get like a Benny card and you get stuff back?
Yeah, that your employer and you can contribute to an account on a pre-tax basis that can be used for healthcare expenses. Oftentimes it comes with a pretty high deductible because there's money being contributed to cover that deductible. Does that sound familiar?
Wait a minute. I don't think so. So I think I used to have one, and if you go buy aspirin or Tylenol and you get the money back.
Okay, good.
Is that what it is?
Yeah, that could also be an FSA, flexible spending account. It doesn't sound like you have an HSA.
Yeah, we just want to make sure.
You generally know if you did.
All right, very good. And so, Jeannie, let me ask you this. Are you the only one that's on your employer-provided plan? Is there a spouse on it, children on? Just you?
My husband is.
He is on it.
My husband is.
Okay, very good. Is he about the same age as you, younger or older?
He's older. He's 66.
Okay, and so he's on that plan. Does he also have A and B or just A only right now?
He has A and B. He's on an Advantage plan.
Oh, he is. Okay. And you're saying, and he's also on your group plan?
Yes.
Mm-hmm. Okay.
Hey, Jeannie, real quick. I don't know if there's a TV on or something in the background, but we keep hearing. It's kind of hard to hear
turn it
you.
down.
Thank you.
All right. That's about it.
Okay.
So your husband has employer coverage, Medicare, and a Medicare Advantage plan.
Yes.
Okay.
But he also has Indian Native benefits.
Okay. Oh, there's a lot. Okay. So he's got
Okay.
four types.
Okay. Sounds good. Well, let me say this to you first of all. You can. Let's talk about your husband, and we'll talk about you. So you can stay right where you are if you want. Okay, you can. But if you have a great group plan, then to me, I don't know why he would even have Medicare Part B. You're paying a premium for that, and unless that's part of the the Indian benefit, I'm not sure. But the majority of people that have good group plans would just have A only because your employer plan pays first. And so Medicare Part B is in the second payer position, and it's costing you all at least $202.90 a month. So again, just food for thought. I'm not telling you to disenroll from it, but you probably do not need that. But if you're comfortable with it, and I'm assuming he's receiving Social Security, is that correct?
Yes.
Okay, see, so that $202.90 is coming out of his check, so he probably hasn't even thought about it. But again, that's food for thought. So you don't really have to have B if you're still covered by a group plan. All right. So my next question to you is, what does it cost you to be on the group plan? How much is that coming out of your paycheck on a monthly basis or pay period or whatever? I'd like to know that. What's the cost for your group plan for you?
It's only $60. We have really good benefits.
Oh, wow. That's awesome. Okay. Very good. So let me tell you what I would suggest doing. If you're happy with your group plan, and I think it sounds like you are, what I would do with you only is as you approach later, November basically would be your month. After November 1, you can enroll into A only. A only.
Okay.
And that's all I would do. You don't have to do B. It's not necessary whatsoever. So if you have an SSA.gov account, you can go online and enroll into A only. If you don't have a SSA.gov account, set one up and take A only. Okay. There's no cost for Medicare A. So that's all I would do. Don't do B. Your husband did B, but you don't have to do B at all. And so that's my advice. Just take A only. Now, and the reason I said that is because you told us you did not have a health savings account. Doesn't sound like you do. So it's fine to enroll into A only. Your group plan still pays first, but the reason I like A only in your situation is if you ever went to the hospital, Medicare could pay some of your co-insurance if you did go to the hospital. Group pays first, Medicare pays second. Again, there's no cost for A. So that would be my advice. Do A only and just keep on working. So the key for you after February 2027 is you just have to stay working and covered by an employer-provided plan. And then once you do decide to retire, then that's when you'll basically 90 days before you retire, then you'll get everything set up for your Medicare coverage. Does all that make sense to you? Okay. Any other questions that you have, Jeannie?
No, and you said he shouldn't be he shouldn't have B because he's covered on my plan.
Exactly right, and this happens all the time. People don't know what to do with their B, but you actually can disenroll from B. And let me tell you, if you want to read about this, the form is called 1763. Form 1763. And at the very top, it tells you can enroll from Part A when you have a premium, Part B, or from what's called immunosuppressive drugs. That's the form that we use to disenroll from those programs. And so that's what I would do if I were you. But if you also, you want to check around, do some reading, your own research. But to me, it's really, truly just a waste of money because you have such a good group plan. But I want you to be comfortable with that, okay? But I'm saying if you would have called me in advance of him, keeping his B, I would have told you to disenroll for sure. And you can still do that. The Form 1763, you can download that, fill it out, and drop it off at a local office or upload it as well, to the Social Security Administration. 1763. And just so you know, that part B, he's not disenrolling from A because he can't. He's going to disenroll from B, and on the form it's called medical. They call it medical. So A is hospitalization, B is called medical, which is the outpatient side. Okay?
Right.
All right.
Because he gets all his prescriptions and his medical through Indian benefits anyway.
Okay. Now let's talk about this. Let's make sure now. What you want to do is this. Before you do what I just told you to do, I want you to call the Indian benefit group and you ask them, say, can I disenroll him from Medicare B? Make sure, because I know it's fine on the group plan because the group plan's paying first anyways. But do clarify that with the Indian benefits because they may say no. We want him to be enrolled in A and B. And if they say that, then you're going to have to stay enrolled in that. Okay?
Okay.
But if that wasn't on the table, then to me it's almost a no-brainer. I drop the B. But you clarify with the Indian benefit group, please.
Okay.
Okay.
All right. Because he's actually paying like $527 right now.
For what?
For B.
Oh wow!
Is it because of high income?
I don't know what they did last year. He took out his 401k. And for some reason, they penalized him for it. I guess.
Yeah, that's right.
Has he worked for a while or is he retired recently?
No, he's been retired since 2022.
Okay.
And last year he took out his 401k. He closed it out. And they penalized him for the income.
Yeah, exactly right. Well, then that'd be another reason to go ahead and disenroll from B. But listen, when you do, if you decide to get out of it, he won't have to pay his IRMA. That's for sure. Then what I would do is in the comments section. Again, providing we're not messing up the Indian coverage. I don't want to mess that up at all. But I would put in the comments section, I do not need Part B because I'm covered by my wife's large employer plan. I'd put that in the comments section of the 1763. And then you may even, maybe put a little note on there saying, and then if we could, stop the B immediately, you can do that. And maybe even, I wish you could get some of that IRMA money back because the normal Part B premium is $202.90. So I don't know if they'll give you a refund for the previous or not. But moving forward, if the Indian coverage is not messed up, let's drop Part B. Okay.
Okay. All right. I'll check into it.
Okay. Thanks, Jeannie.
Sounds
Take
good.
care.
Great to talk to you.
Thank you. Thank you.
Bye-bye. Guys, thanks for being a part of today's show. Thank you for all of our callers. If you guys want to be a part of tomorrow's show, we'll be back here at 11 a.m. Central. Phone number is 833-824-2004. Tomorrow, we're going to be talking about what does it cost for a couple, not just in Medicare premiums, but all in healthcare cost, because it's the biggest cost that you're going to have in retirement. You need to make sure that you've saved enough money, that you have enough income stream set up, all those sort of stuff. So we're going to talk about kind of an overarching, if you're married, you're a couple, there's some studies out here on what it's going to cost for you that you need to have set aside just for healthcare. And it's kind of a staggering amount. So tune in with us tomorrow, guys. If you need help comparing your plans, getting plans set up, enrolling in Medicare A and B, supplements, Advantage plans, all the coverage that relates to Medicare, we would love to help you. We're a team of insurance brokers. Our services are free, and we've got 5-star ratings just about everywhere you look, and would consider an honor to work with you. So if you need help, call our office. It's 800-782-6676. 800-782-6676. And we consider it an honor to help you. See you tomorrow.